Hi, welcome to Special Care Nursery. My name is Kerry.
And I'm Dolores.
Your baby might need to be admitted to Special Care Nursery if your baby's been born early or is of low birth weight. It might have problems with its sugars, query an infection, or maybe some respiratory distress.
When your baby comes to Special Care Nursery, the first thing we do is weigh your baby and then generally go onto the open cot and put some monitoring on. You'll hear alarms. They're just to let us know how your baby's going at this stage.
Attending to your child while it's being stabilised will be a number of nursing staff and a number of paediatric doctors.
During the stabilisation of the baby, the non-birthing parent can come up and meet the baby and stay with the baby during this time. Once the mum is well enough, the nursing staff will bring mum up to visit her baby.
Once your baby has been stabilised, it might be joining mum back out on the ward in postnates, or it might be admitted to the unit here in Special Care Nursery, or if we're unable to stabilise your baby, it might be taken to a tertiary hospital in Melbourne via Piper, which is the transport team from the Royal Children's Hospital.
Hi, my name's Judy. I'm one of the lactation consultants at Ballarat Health Services, and I'd just like to talk to you a little bit about what might happen if your baby is born a little bit early, so if you have a premature baby, or for any reason your baby might need to be admitted to our special care nursery after the birth. So in this case, you would be on the postnatal ward and your baby would be in the special care nursery, which is right next door to the postnatal ward. So a lot of mums worry in that case about how they're going to establish breastfeeding for their baby. So of course, if your baby is able to breastfeed, you are not a visitor in special care nursery, you are welcome to go in there all the time. So you're not considered a visitor, you're the baby's parent. So we encourage you to be in the nursery as much as possible, to be with your baby, to do skin-to-skin contact, to breastfeed, and to establish breastfeeding as you normally would if your baby is able to breastfeed. If for some reason your baby can't breastfeed, for example, if the baby was born a bit too early or your baby might be unwell, then we encourage you to start expressing your breast milk as soon as possible after birth. So that's within about an hour after birth. So the midwife will teach you how to hand express, and she can help you do that. And then we want you to start to continue expressing about every 2 to 3 hours for the first couple of days, and this will help to bring your milk in and establish your milk supply so that when your baby's able to breastfeed, then you will have the milk available for your baby. So the main thing with this is that you need to start early, within about an hour, and you need to continue expressing about 8 times every 24 hours until your baby's able to breastfeed. And that sounds like a lot, but it's about how often a baby would breastfeed anyway. So initially we get you to hand express, and we'll show you how to do that, and the midwives can help you if you're not able to do it yourself. And then we can also show you how to use one of our hospital breast pumps, and we'll also talk to you about whether you might need to have a breast pump for use at home or not. So that's all the sort of information that we can give you at the time if it happens. So your expressed breast milk is the best food for your preterm or unwell baby. So we know that with all the protective factors in breast milk, that this is so beneficial for babies in special care nursery, and really we think of it as the best medicine for your baby. So as much as possible, we want to try and give your baby only your breast milk while they're in nursery. Sometimes, if there's not enough breast milk initially, we might use some supplementary feed of formula, but we would always ask your permission before we would do that, and we try to avoid that if possible. And that's again where having some frozen stored colostrum that you might have expressed antenatally is really handy to have in case your baby needs that little bit of extra milk. So for preterm babies, as I said, we talk about your breast milk as the baby's best medicine, and it's the medicine that only the mother can give the baby. So that's a fantastic way that you can help your baby to grow and become healthy if Bub is in special care nursery. So it's good to think about what you might do if you were separated from your baby for any reason. Maybe hop online, research some different breast pumps, etc. Maybe talk to some friends and family to see if anybody's got a pump that you could borrow. I wouldn't say you have to go out and buy a breast pump. It's not an essential item to have on hand, but it's something you might want to think about purchasing or borrowing after the birth of your baby if the need arises.